Most men over 60 walk past it every single day. It sits quietly on the kitchen shelf. It costs almost nothing. It has been in the home for decades, used occasionally for baking, perhaps for cleaning, perhaps forgotten entirely at the back of a cabinet behind everything else. And yet what this one ordinary white powder can do for the aging male body after 60 is something that the vast majority of men have never been told. Not because the information is hidden, but because nothing this inexpensive and this accessible ever receives the attention it deserves in a world that profits far more from complicated solutions than simple ones. Today, I want to change that. 10 specific benefits of baking soda that are relevant, practical, and genuinely supported by research. Explained clearly enough that by the end of this video you will understand not just what baking soda does, but exactly why it does it, and how to use it safely as part of daily life after 60. Stay with me through all 10, because the ones toward the end of this list are the ones that surprise men the most. Before we begin, one thing needs to be stated clearly and held throughout everything that follows. Baking soda is sodium bicarbonate. It is a naturally occurring compound that the body itself produces. The kidneys generate bicarbonate as part of the mechanism that keeps the blood's pH within the narrow range that every biological process depends on. When used appropriately and in modest amounts, it works with chemistry the body already understands. But it is not without considerations, particularly for men over 60 who may be managing blood pressure, kidney function, or taking medications that interact with changes in body chemistry. Everything discussed today is general health information. Nothing replaces a conversation with your own doctor about what is appropriate for your specific situation. That context established, let us begin. The first benefit is one that most men over 60 experience daily without ever connecting it to something as simple as baking soda. Joint discomfort and the inflammatory environment that drives it. After 60, chronic low-grade inflammation becomes one of the most consistent underlying factors in the physical experience of aging. It contributes to joint stiffness, to the aching that is worse in the morning and after long periods of stillness, and to the general physical heaviness that most men attribute entirely to age. Here is what the research shows about baking soda and inflammation that most people have never heard. A study published in the Journal of Immunology found that drinking a solution of baking soda and water appeared to signal the spleen to promote an anti-inflammatory response, specifically influencing the balance between pro-inflammatory and anti-inflammatory immune cells. Think of the immune system like a thermostat in that old house after 60. Sometimes the thermostat gets stuck in a position that keeps the heat running higher than it needs to. Baking soda appears to help nudge that thermostat back toward a more balanced setting. This is very common after 60. Most men are living with an inflammatory environment that is measurably higher than it needs to be, and that responds to surprisingly simple interventions. The connection between something as ordinary as baking soda and something as significant as systemic inflammation is exactly the kind of information that changes how people think about what is already in their home. That is why you may notice that men who include modest amounts of baking soda water in their routine report improvements in how their joints feel over time, not overnight, but cumulatively and meaningfully with consistency. The second benefit connects directly to something most men over 60 experience, but rarely discuss openly. Exercise, performance, and recovery. After 60, one of the most discouraging aspects of physical activity is how much longer recovery takes compared to earlier decades. A walk that would have caused no residual fatigue at 45 can leave the legs feeling heavy and sore for a day or two at 65. And that extended recovery time becomes one of the primary reasons men gradually reduce their physical activity, which then accelerates the very muscle loss and cardiovascular decline that make everything harder. Here is the mechanism worth understanding clearly. During physical exertion, muscles produce lactic acid as a byproduct of energy generation. As lactic acid accumulates, the muscle environment becomes more acidic, which contributes to the burning sensation during exercise and the soreness and fatigue that follow. The body's natural buffering system, which includes bicarbonate, works to neutralize that acidity and restore the muscle environment to its optimal pH range for recovery. Baking soda is sodium bicarbonate. When consumed in appropriate amounts before or after physical activity, it increases the bicarbonate available to buffer the acidic environment created by exercise. Multiple studies have found that this can reduce the rate at which muscles fatigue during exertion and improve the speed of recovery afterward. For a man over 60 whose recovery window is already longer than it once was, even a modest improvement in that timeline makes a meaningful difference in how consistently and how vigorously he can maintain the physical activity that determines his long-term health trajectory. A quarter teaspoon dissolved in a glass of water, approximately 60 to 90 minutes before moderate physical activity, is the approach most commonly studied. Start with less if this is new, and as always, discuss with your doctor if you are managing any conditions that involve kidney function or blood pressure. The third benefit is one that affects nearly every man over 60 at some point, and that most treat with expensive over-the-counter products when a solution may already be sitting in the kitchen. Acid reflux and digestive discomfort. After 60, the lower esophageal sphincter, the valve that prevents stomach acid from traveling upward into the esophagus, becomes less reliable than it was in earlier decades. The result is the familiar burning sensation of acid reflux that most men know well, along with the bloating, the post-meal discomfort, and the disrupted sleep that comes from lying down with an irritated esophagus. Baking soda is an antacid. When it meets stomach acid, a neutralization reaction occurs that reduces the acidity of the stomach environment and relieves the burning sensation of reflux almost immediately. This is the same chemistry that makes it the active ingredient in numerous commercial antacid products, but without the additives, the cost, or the packaging. Think of it like this. Stomach acid is like an unwanted fire burning in a room. Baking soda is the water that douses it, not by removing the source of the heat permanently, but by neutralizing the immediate burn quickly and completely. Half a teaspoon dissolved in a glass of warm water, consumed slowly after meals or when reflux symptoms arise, is the traditional and commonly used approach. The important warning here is that regular, daily, long-term use of baking soda for reflux management is not recommended without medical guidance, particularly for men over 60 managing blood pressure, because baking soda contains sodium and consistent high intake can affect fluid balance and blood pressure. Used occasionally and appropriately, it is a simple and effective tool. Used as a substitute for proper medical management of chronic reflux, it masks a problem that deserves proper attention. The fourth benefit is one that connects to the kidney health conversation that most men over 60 are not having nearly early enough. Supporting kidney function in men with mild chronic kidney disease. The kidneys after 60 operate with reduced reserve compared to earlier decades. Their ability to filter waste products, regulate fluid balance, and maintain the blood's pH within its required range all diminish gradually and often silently. And one of the key mechanisms by which the kidneys maintain pH is through the production and regulation of bicarbonate. When kidney function is impaired, bicarbonate production decreases. The blood can shift toward a more acidic state, a condition called metabolic acidosis, which then accelerates the progression of kidney disease itself, contributes to muscle wasting, affects bone density, and creates a cascade of downstream consequences that compound with every passing year. Multiple clinical studies and established nephrology guidelines recognize sodium bicarbonate supplementation as a tool for slowing the progression of chronic kidney disease in certain patients, specifically those who test low in blood bicarbonate levels. The research suggests that restoring bicarbonate levels in these patients can meaningfully slow the rate at which kidney function declines. This is very common in men over 60. Mild kidney function decline is one of the most prevalent and least discussed aspects of male aging. And for men in this situation, a conversation with their nephrologist or primary care physician specifically about bicarbonate levels and whether supplementation is appropriate could be one of the most important medical conversations they have. This benefit, more than any other on this list, is one where individual medical guidance is not optional. It is essential. The fifth benefit is one that every man over 60 who cares about his cardiovascular health should understand. Blood pressure and vascular function. This one requires nuance because baking soda contains sodium, and sodium is a well-established contributor to elevated blood pressure. At first consideration, this would seem to place baking soda firmly in the category of things men with blood pressure concerns should avoid. But here is where the picture becomes more interesting. The relationship between baking soda and blood pressure is not simply about sodium content in isolation. When used in modest amounts, well below the levels at which sodium intake becomes clinically concerning, some research suggests that the bicarbonate component may support vascular function. Its effect on nitric oxide availability. Nitric oxide is the molecule responsible for signaling blood vessels to relax and widen, allowing blood to flow with less resistance. Supporting nitric oxide availability is one of the central mechanisms through which cardiovascular health is maintained after 60. The example that makes this tangible is straightforward. Imagine the blood vessels as a network of garden hoses. When those hoses are narrow and stiff, the pump, the heart, must work harder to push the same volume of fluid through them. When they are relaxed and wide, the same fluid moves with far less resistance and far less demand on the pump. Bicarbonate's potential role in supporting nitric oxide availability speaks directly to that widening and relaxing mechanism. For men over 60 who are not managing blood pressure concerns and who are not on sodium-restricted diets, occasional modest use of baking soda is unlikely to affect blood pressure meaningfully. For men who are managing hypertension or are on sodium-restricted protocols, this conversation belongs with their doctor before any regular use begins. The sixth benefit is one that most men never connect to something in the kitchen, but that affects physical comfort and athletic longevity more than almost anything else discussed today. Muscle cramps and pH balance in the muscular environment. After 60, nighttime leg cramps, those sudden, involuntary, painful contractions that wake a man from sleep and take long minutes to resolve, become significantly more common. They are caused by a combination of factors including reduced circulation, electrolyte imbalances, and changes in the way the nervous system communicates with muscle tissue during the lower activity state of sleep. The pH of the muscular environment plays a role in how effectively muscle cells respond to neural signals and how efficiently they complete the cycle of contraction and release. When the local muscle environment becomes more acidic, through dehydration, through the metabolic byproducts of daily activity, through the reduced buffering capacity of aging physiology, likelihood and severity of cramping increases. Baking soda's role as a systemic alkalizing agent, modestly raising the pH of the blood and tissue environment when used consistently and appropriately, may support the muscular environment in a way that reduces the frequency and severity of these cramps over time. This is not a dramatic or immediate intervention. It is a gradual, cumulative one, the kind that shows its results over weeks rather than days. Paired with adequate hydration, adequate magnesium from dietary sources, and the gentle daily movement that keeps lower body circulation active, consistent modest baking soda use may contribute meaningfully to reducing the nocturnal cramping that disrupts the sleep quality so many men over 60 are already struggling to protect. The seventh benefit is one that most men over 60 have direct personal experience with but have never associated with anything as simple as baking soda. Urinary tract health and the environment of the bladder. After 60, the male urinary system undergoes changes, including prostate changes that affect urinary flow and bladder function. that make the entire urinary environment more susceptible to irritation and infection. Urinary tract infections, while more commonly discussed in women, are not uncommon in older men, and they carry greater complication risk in this age group than they do in younger populations. The pH of the urine plays a direct role in how hospitable the urinary tract environment